go through the meetings today, let's appreciate what each of us are doing, inspire one another to do more, to raise the bar even higher than we ever think is possible.
Gun violence is much more than an individual or family issue. It has community and ripple effects that impact population health and population mental health, and that require public health strategies to interrupt these cycles and these ripples.
To me, is most important is you have to keep talking to people. And all of you, and whatever it is you do in public health, you see a lot of people. You need to draw people out.
There are infinite numbers of individuals, especially children, whose lives are impacted, interrupted, whether or not they ever get shot. I live in the south end of Hartford. It's a neighborhood with high rates of violence. And when I talk to kids in my neighborhood, and I do that often, they tell me that inside school they feel pretty safe compared to how unsafe they feel walking to and from school. Every single day they fear for their life, walking to and from their school. Their brain chemistry is altered. Their brains are broken by that constant exposure to violence and trauma. They are unable to learn, they are unable to make friends, they are unable to cope. That is one of the reasons why we talk about this as a public health epidemic.
We had the largest convening in this administration's history with state legislators from 39 states talking about a safer states agenda that had a host of solutions: investment, survivor supports, infrastructure, as well as gun safety laws.
If you are a student, you live on a block where a homicide has taken place, in the week following that incident, you will test as if you have missed 2 years of school. We know education is itself incredibly protective against future gun violence involvement, so even just thinking about the behavioral health impacts that gun violence has on root causes, I think is really important.
When we think about gun safety and the realities around it, it is a health issue, it's a wellness issue, it's not a political issue. My biggest worry is it gets politicized, and already has been.
We do things better when we do it together, and that's what we say in Arlington all the time. Having the voice of Northwell and all of you different healthcare professionals adds tremendous credibility to what President Biden is trying to do, to what our senators and our congressmen and women are trying to do, to what our local officials are trying to do.
It's so exciting to help build the community infrastructure in concert with public safety and public health to make for stronger communities.
I just want to tell the healthcare system that really look at art and how it overlaps in health, how it correlates, reimagine the healthcare system.
It's been inspirational to see over the last 4 or 5 years how this movement has grown and the number of health systems that have really joined this cause.
Positive change, no matter how small, is always important. That's how change occurs. Incremental piece by incremental piece. Because when you're on an effort like this, and the journey is long, and the goal seems far off, it is very important to recognize that along the way we're making some positive change.